My name is Iris and I'm 8 years old. When I grow, I might be a teacher and I'm going to teach children.
Hi, my name is Kwang Lee and I'm 13 years old. When I grow up, I either want to be a teacher or a doctor.
This is Emily. Avila, she's 2.
My name is Shota Moreno and I am 7 years old. I want to be a nurse helping children and people don't get sick.
My name is Taylor Gardner and I'm 16 years old. I really want to be a photographer when I grow up.
Hi, I am Rafael Lewis and I am 7 years old. And when I grow up, I want to be a construction worker.
Hi, I'm Shannon and this is Devaney. She's almost 4 months.
My name is Ariel Legaspi. I am 24 years old.
Hi, I'm Jim Bradley, and I'm a member of the Facing Forward team. The focus of Facing Forward is to treat children born with major facial deformities. Children that, without Facing Forward, without UCLA craniofacial surgery, will not get the corrective surgery they need. Typically, surgery is done as infants, at school age, and then finally as teenagers, and the goal is to help them achieve a normal appearance by teenage years, and also to help them through those formative years, both socially and emotionally.
I have my daughter Lily Stewart. Lily's 5 months old. It's called Pierre-Robin sequence. Basically it means that her jaw was recessed enough that her tongue occluded her airway, so when she was born she was unable to eat or breathe on her own. It was awful. The doctors at the hospital we were at in a metropolitan area told us that she would have a tracheostomy and would have a stomach tube until she was at least 4 years old. We did some research and found Dr. Bradley. Lily had her first surgery when she was a week and a half old, and it was a jaw distraction surgery, which ultimately they broke her jaw and pulled it forward, which allowed her to then breathe on her own, and we were then able to feed her with a bottle soon after the surgery. Ready, say thank you very much.
One child may need 3-4 procedures throughout their life. Most of these procedures that are done on Facing Forward children are major surgeries. The hospital fee typically is about $8,000 just for the stay overnight. These surgeons and other physicians work on a volunteer basis, and we get discounted fees in order to get these surgeries done, so that all donated fees to Facing Forward go directly to helping the children have these surgeries. A typical major surgery can be anywhere from $14,000 to even $35,000.
I don't really know what it's called, but I think I know a little bit. The tumor in my face is like it's just like keep growing and growing until it's keep growing. It's non-stop.
Kwang was born with a different type of neurofibroma. When Kwang first came to us, his tumor mass was so large it involved his right temporal area, right cheek, into his right jaw, and it was so heavy that he had to tilt his head to the right.
I have 4 surgery in my face with Dr. Bradley.
After Kwang's first major surgery, he underwent a second surgery to take out the rest of the mass around the facial nerve. Because the mass was so heavy, it affected his bone growth. Additional surgery for Kwang will involve reconstructing the bones on the right side of his face.
I am Kathy Pedigo and I'm Taylor Gardner's mom.
I was born with Pfeiffer syndrome,
which is a very rare craniofacial deformity. Just random. She's what's called a spontaneous mutation. Doesn't sound very nice, but I think the occurrence, they told me, is 1 in 500,000.
I know there was a difference obviously in my eyes. They protruded more than normal.
Oh, Taylor had her first surgery when she was 3 months old, and that was basically to open the sutures on her skull, the soft spots that babies are born with. She didn't have that. And they had to do that to allow room for her brain to grow. If she didn't have the surgery, it would have been life-threatening. She obviously would have been, mentally not competent and probably would not have lived. I just, I want her to be happy. The first time she saw Dr. Kawamoto when she was 4 days old, it was pretty daunting. He's a pretty amazing person to be around in his presence, and he asked if we had any questions. And I said, yes, I want to know if my daughter will go to the prom. And he said, I promise you she will.
Thank you very much.
Thank you very much.
Thank you very much.
Thank you.
Thank you very much.
On behalf of Facing Forward, I would like to thank you for your support. On behalf of Facing Forward, the physicians at the UCLA Craniofacial Clinic, and all the children that come through the clinic, thank you.